The price of alcohol sold at off-licences and supermarkets should increase to cover the cost of rehabilitation for those dependent on it. That's according to the Centre for Social Justice. The think tank, which tries to address poverty and its causes, is concerned about cuts to existing services and wants the government to consider what it calls a treatment tax. Our social affairs correspondent Michael Buchanan has the details.
At the Queen Alexandra Hospital in Portsmouth, alcohol is one of the key reasons that people are admitted.
First of all, can I ask you, do you ever drink alcohol?
Occasionally.
Occasionally.
Occasionally. Yeah.
Since 2010, therefore, every patient arriving here, no matter what's wrong with them, has been asked how much they drink. Simple questions help nurses identify problem drinkers, and the shock of being in hospital gives staff an opportunity to begin changing behaviour.
People are really frightened about their health and they want to make a change. So we try to use that moment to its fullest, and we explain how alcohol's had a big impact on their health.
Any headaches at all?
Yeah, I had a headache yesterday.
The project has been a success. Patients have come off alcohol and stayed out of hospital. But such schemes are rare, says today's report. Researchers are therefore urging the government to introduce what they're calling a treatment tax on alcohol and to use the money raised to fund residential rehabilitation centres.
For minimum increase, 9 pence on a bottle of wine, 2 pence on a can of lager, we think we can raise £1 billion over the next 5 years to get treatment flooding through our country again. And we need to, because the Treasury is spending billions of pounds a year picking up the mess.
A similar proposal by the CSJ in 2007, when Ian Duncan Smith was in charge of the think tank, and it's understood he continues to support the idea. But the Department of Health said they have no plans to put more duty on alcohol. Instead, they say they're giving councils more than £5 billion to help them fund treatment courses. Michael Buchanan, BBC News.
Well, I'm now joined by Christian Guy, the Director of the Centre for Social Justice. You saw him in Michael Buchanan's report there. Mr. Guy, first of all, just to try and get the scale of this problem, the numbers involved very, very high.
They are high, so we know about 1.6 million people are dependent on alcohol, but we've seen some figures that worry us because the number of alcohol-related hospital admissions have gone up and doubled in a decade. We know that liver disease is one of the big 5 killers, and it's the only one on the increase. Alcohol-related deaths increasing. So we see that there's a social cost. There's also a big economic cost too.
And we're talking about people, it must be said, of all ages, really, aren't we? And one tend to think of older people who've had a lifetime of drinking too much, but actually an awful lot of young people.
Young people
too much.
Drinking earlier these days. They're also looking at drugs like legal highs, but it can affect all of us. We know that. But at the same time, we've seen that this addiction flourishes in some of the poorest communities alongside some difficult social problems like long-term unemployment, family instability. All these factors can push people towards addiction as well.
Now, the rehabilitation, we saw there that there's a hospital in Portsmouth where they take it very seriously, they go through all that, but that's pretty unusual, isn't it? What's been happening to the whole idea of rehabilitation right across the country?
Well, for a long time, we've assumed that the best response has to be managing addicts. So we often put, say, heroin addicts on substitute drugs. We do very little to help with alcoholics other than some perhaps talking therapies. And we're saying that that needs to change because all we're doing now is spending to pick up the mess. And so what we think is a much more opportunity for people to get clean. At the moment, you've got to be pretty wealthy to check yourself into rehab. There aren't many rehabs for people of lower incomes, and we want that to change in a major way too. So it's about rehabilitation that gets people clean, rather than this idea that we just manage and stabilise people in some kind of decline.
And it was suggested, I believe, your same organisation suggested this back in 2007. Here we are 7 years on. Nobody picked it up at the time.
We almost had minimum unit pricing, which would actually increase the price of alcohol much more than our scheme. But we're saying for a minimal increase, about 2 pence on a can of lager, 9 pence on a bottle of wine, we can use that money, more than £1 billion in the next 5 years, to expand treatment around the country and to get on with the job. Because nobody really heard it last time. They heard it but didn't act on it. We think it's the right thing to do. The problem is getting worse, so we're saying that it's incredibly important for now.
Are there any lessons to be learned from abroad, I wonder about? Is there anywhere else where rehabilitation is much better? One always thinks, for some reason, probably wrongly, that once alcoholism gets a grip on people, it's very, very tough to do anything about it at all, no matter how good the programs, no matter how much help you offer.
It is messy, and there's no guarantee, but some of the best rehabs in our country get up to 80% of those they're working with clean and sustained in that recovery. So it's certainly possible, and We want to challenge that lack of ambition for addicts that at the moment tends to dominate. We want to be hopeful and ambitious for people. And some will fail, and for others it may take 20 or 30 goes, but we can't write them off as we have been for so long.
But because in this country we have the idea that taxes are not ring-fenced, are they? We don't say, well, it's 2 pence here, that'll go to that. It would have to come out of general taxation. All we're talking about is pushing up prices, and so the general level of tax will rise.
Well, we would want a specific tax, however the Treasury was to apply it, where you did ring-fence the money, because at the moment alcohol duty is going on many things. We know the treatment budget is spread across pretty ineffective work too. So for a bit more of an increase on our alcohol purchases, not in pubs, clubs and restaurants, only in we think we can get the money we need, and we would want it ring-fenced. Otherwise, it's just another tax increase, and that's never popular at the best of times.
Indeed. Christian Guy, thank you very much indeed.